In regards to treatment, there are usually two treatments that can be given to patients with an ischemic stroke. These treatments are thrombolysis and thrombectomy. In the thrombolysis treatment, patients who have had an ischemic stroke are injected with alteplase. This medicine acts to dissolve the blood clots, restoring the blood flow to the brain, and is the most effective treatment for a stroke if administered within 4.5 hours of the stroke. On the other hand, a thrombectomy is an emergency procedure used to treat strokes caused by clots in large arteries. In this procedure, a catheter with a small device on it is pushed up the artery, where the clot is removed by the device or through suction.
Ischemic strokes are commonly caused by a lack of blood flow due to blocked or narrowed arteries leading to or within the brain. Narrowing can happen due to atherosclerosis, the occurrence of fatty plaque lining the blood vessels. The blockage can result from a blood clot from a damaged area of the plaque or from elsewhere in the body. Hemorrhagic strokes are caused by a rupture of a blood vessel leading to compression of the brain tissue from the expanding hematoma. This can damage the tissue and lead to a loss of blood supply to the affected region, resulting in infarction. The blood released also has toxic effects to the brain tissue and the surrounding vasculature. This stroke commonly happens in the intercerebral region or the subarachnoid region of the brain.
As far as individuals who suffer from strokes, research shows that each year almost 795,000 people in the United States have strokes, of which 137,000 die. When it comes to race and ethnicity, African American people seem to have twice the risk of having a stroke as compared to Caucasians. Hispanic Americans and First Nation individuals tend to have higher risk than Caucasians, however lower risk compared to African Americans. Age is also an important factor since individuals who are aged over 65 years tend to have higher risks of having strokes. And finally, in terms of gender, men compared to women are usually more susceptible to having strokes.